When we begin talking to fellows about MIPS reporting, the look we commonly get is something like the one you see depicted here. For 2018, I want to reassure you that it is once again not terribly onerous, and no fellow should accept a penalty in their reimbursement in 2020 based on their performance for this year. It is simply too easy to avoid such. The purpose of this presentation is to show you how to avoid that penalty. For 2018, as was the case for 2017, we will be concentrating our efforts directed at avoiding a penalty in the improvement activities component of MIPS. By meeting the requirement to receive full credit for the improvement activities, one will meet the threshold required to avoid a penalty based on their 2018 reporting. Reporting improvement activities is by simple attestation. This may be accomplished via either a qualified clinical data registry like the ACS's Surgeon Specific Registry, aka the SSR, or via a portal on the CMS website. Examples of improvement activities include consultation of a prescription drug monitoring program prior to the issuance of a controlled substance Schedule II opioid prescription lasting longer than 3 days, seeing new and follow-up Medicaid patients in a timely manner, including individuals duly eligible for Medicaid and Medicare, participation in a QCDR, clinical data registry, or other registry run by a government agency or private entity, such as a hospital or a medical or surgical society. Examples of this would be the SSR, the ACS's Surgeon Specific Registry. Participation in Maintenance of Certification Part 4, provision of specialist reports back to referring providers to close the feedback loop, bilateral exchange of necessary patient information to guide patient care. This can be done either electronically or through the use of structured referral notes, annual registration by eligible clinician or group in the PDMP of the state where they practice, use of patient safety tools that assist specialty practices in tracking specific measures that are meaningful to their practice. Specifically, this would include use of the ACS's surgical risk calculator or the use of enhanced recovery after surgery protocols. More information on these and other activities can be found on the Quality Payment Program website. Using a series of questions, we will now discuss how you can go about determining if you are required to submit data individually for MIPS in order to avoid a penalty, and if so, your best option to avoid such. First, you should determine if all your MIPS data will be reported for you by your institution, employer, or group via the group reporting option. Next, has CMS notified you that you are exempt from MIPS reporting based on the low volume threshold, or are you considered a participant in an advanced APM such as an ACO? By typing in your MPI number at the link displayed here, you can determine the answer to both of these questions. Step 3. If your data is not being reported for you and you are not exempt, your best option is to simply complete the requirements for the improvement activities component of MIPS. You will meet that requirement by simply attesting that you have completed between 1 and 4 of the improvement activities for at least 90 days during the calendar year 2018. Those in rural or small practices are only required to attest to having completed 1 of the high-value activities or 2 of the medium-value activities. However, all others are required to attest to having completed either 2 high-value activities or 1 high-value and 2 medium-value activities, or 4 medium-value activities. Again, the Surgeon Specific Registry, SSR, has been specifically configured to facilitate fellows' reporting of the requirements of the improvement activities. In the next presentation, we will discuss in a step-by-step fashion exactly how to go about reporting on the SSR.